My name is Kate Bourne, and I live in St. George, Maine. I have made global health my career, but this year, the greatest health threats were also close to home. As the seriousness of the pandemic became clear last March, it also became evident that developing a local COVID response was not the explicit responsibility of any entity. Citizens and community organizations came together to fill the void, and we in St. George have been meeting weekly for the past year. One of our very first acts was to post requests around town for people arriving from out of state to quarantine. This was in advance of the governor's directive, and to give them a list of resources to help them do so safely. We then developed an online community resource guide with basic information about COVID-19 at the point when the CDC information was still pretty limited, and also the various services available if people were having difficulties. Today, that guide includes up-to-the-minute information about how to get vaccinated. Each week, the group identifies gaps or problems and collaborates on ways to solve them, whether it's finding additional space in town to allow in-person school to continue, or designing the safety precautions needed to help neighbor transport service to restart, or helping seniors access telehealth appointments. It has been inspirational to see the community pull together. As inspirational as the resilience of our community has been, we know that there are many needs that we are not able to meet. And many communities do not have the basic organizational building blocks or expertise that ours had. So many people throughout our state and our country have died or are dealing with debilitating after effects of COVID, and many others are struggling with economic and mental health challenges. An ad hoc community group, however good its intentions, cannot take the place of well-resourced national and state level public health infrastructure, planning, and communications. If there's anything that this pandemic has shown us, it is that we need to make increased investments in all of these areas. We buy fire insurance even though very few houses burn down. We invest in military equipment that we don't deploy for decades. In comparison, the likelihood of another pandemic is unfortunately not small at all. And investments in public health will not only help us prepare for future pandemics, but will also improve our community's health right now.